the guidance that we have provided continues to be the same and is consistent with the metrics and measures that we put out in the fall, using the state guidelines as well as the CDC guidelines in terms of metrics and markers where we thought would be safe to come back, related to test positivity and community transmission rate as evidenced by case rates. And the numbers that we have are moving in that direction, which is favorable. What's also different now than before, which again, I continue to emphasize, is that we are seeing teachers and education staff get vaccinated and have access to that. I do think it is important for them to be able to have access to at least one shot before going back into the classroom. I know some may say that's controversial given some of the CDC guidance, but I do think we should, continue to ensure that they have access to that as an added layer of protection when they go into the classroom. Based upon Dr. Stoddard and I we meet regularly with our colleagues at MCPS, and based upon the tremendous amount of work that they have put into planning and, coming up with different provisions and safety measures to put into the classroom to mitigate transmission, we feel that they've done their due diligence in that and to continue to refine. Now, that said, I think, anyone should be concerned, going back into work person to person, but, we do feel that they have put a lot of effort in terms of coming up with different contingency plans and safety measures to mitigate transmission as much as possible. And we will certainly continue to. Again, we don't make those decisions. So again, for everybody at home, the health department does not make the decisions whether or not school's open. But we will continue to monitor our guidance that we have provided to them, based upon the surveillance information we have at hand.